Dementia. It's more than occasional forgetfulness. It's a severe decline in mental ability. Imagine a once vibrant individual struggling to remember familiar faces or perform routine tasks. This decline affects memory, thinking, language, and behavior. It's a progressive condition, with symptoms worsening over time. The impact on individuals and their loved ones is profound, demanding understanding and specialized care. The World Health Organization estimates over 55 million people live with dementia globally. This number is projected to nearly double every 20 years, making dementia a pressing global health concern. As future healthcare professionals, it's crucial for nursing students to understand dementia, its forms, and management strategies. This essay aims to equip you with the knowledge and tools to confidently approach dementia care in your NCLEX exam and future nursing practice. Dementia isn't a one-size-fits-all diagnosis. It encompasses various types, each with unique characteristics and challenges. Alzheimer's disease is the most common type, accounting for 60 to 80% of cases. It's characterized by the buildup of amyloid plaques and tau tangles in the brain, disrupting communication between brain cells. Vascular dementia, the second most common type, results from reduced blood flow to the brain, often due to stroke. Lewy body dementia is characterized by abnormal protein deposits called Lewy bodies, affecting thinking, memory, movement, and behavior. Hallucinations and fluctuations in alertness are common in Lewy body dementia. Other types include frontotemporal dementia, mixed dementia, and reversible dementias caused by treatable conditions. Understanding the nuances of each type is essential for providing individualized care and support. Knowing the common symptoms and progression enables nurses to anticipate patient needs and develop effective care plans. While there is no cure for most types of dementia, various medical approaches can help manage symptoms and improve quality of life. Medications play a crucial role in managing cognitive symptoms and behavioral changes. Cholinesterase inhibitors like donepezil are commonly prescribed for Alzheimer's disease. Memantine regulates glutamate activity in the brain, potentially slowing the progression of symptoms. Antidepressants and antipsychotics may address behavioral and psychological symptoms. Non-pharmacological therapies, such as occupational, speech, and physical therapy, are equally important. Lifestyle modifications like regular exercise and cognitive stimulation can also play a significant role. Early diagnosis and intervention are crucial for maximizing the effectiveness of these strategies. Section 4. The Nursing Touch Compassionate Care for Dementia Patients. Nurses provide direct patient care, education, and support to both patients and their families. Building a trusting relationship with patients is paramount, especially as dementia progresses. Using clear, simple language and maintaining eye contact can enhance understanding and reduce anxiety. Patience, empathy, and a calm demeanor are essential when interacting with patients. Creating a structured and predictable environment can reduce confusion and promote a sense of security. Establishing a consistent routine for daily activities can provide normalcy and reduce anxiety. Nurses play a crucial role in educating families about dementia and available resources. Advocating for patients' needs, ensuring their safety, and preserving their dignity are integral aspects of compassionate care. Section 5. Hospital Care Strategies. Creating a safe and supportive environment. Hospitalization can be particularly disorienting and stressful for dementia patients. Nurses play a crucial role in creating a safe and supportive hospital environment. Clear communication and frequent reorientation are essential for reducing confusion. Providing a calm and quiet environment can minimize agitation and promote rest. Familiar objects from home can provide comfort and a sense of security. Safety is paramount for dementia patients who may wander or experience falls. Close observation, bed alarms, and door sensors can help prevent falls and wandering. Engaging patients in meaningful activities can reduce boredom and restlessness. Involving family members in care can provide comfort and familiarity for patients. And Section 6. Mastering Dementia for NCLEX Tips and Tricks. Preparing for the NCLEX exam can feel overwhelming, especially with a complex topic like dementia. Start by understanding the basics of dementia, including its definition, types, and common symptoms. Focus on the key characteristics of each type, such as amyloid plaques in Alzheimer's and Lewy bodies in Lewy body dementia. Familiarize yourself with common medications used to manage symptoms and their potential side effects. Remember that non-pharmacological approaches are equally important in dementia care. Practice applying your knowledge to realistic scenarios. Utilize NCLEX review books, practice questions, and online resources to reinforce your understanding. By mastering effective communication strategies and prioritizing patient safety, you'll be well equipped to excel in your exam and provide compassionate care to patients.